This is the Marriage Podcast, and I'm your host, Alexandra Stockwell. I'm a physician turned relationship and intimacy expert, and I specialize in showing couples how to have incredible, passionate relationships. I myself have been married for 25 years. My husband and I have 4 children and full professional lives, and we've created an amazing relationship. If you want to deepen your understanding of your own relationship, and learn to access new heights of emotional, sensual, and erotic intimacy, you're in the right place because I will show you how. Let's dive in. Hey everyone, this is Alexandra, and it's really my pleasure today to invite you to meet Dr. Melanie Modjoros. She and I were on a panel with other women physicians, a panel for women physicians. And I have to say, well, we didn't really know one another at all before the panel. I came away with a girl crush because our stories are different, our contexts for practicing and serving are different, but we have so much resonance in our respective approaches that, of course, I wanted to invite Melanie on the podcast and let all of you listen to one of our conversations. So I know that there's so much to say about your background. You're a board certified gynecologist, I believe. So will you cover all of those kinds of important details that you'd want listeners to know? And a big warm welcome, Melanie.
Thank you so much, Alexandra. Yes, I was thrilled to meet you too on that Zoom call. And I thought we had a great conversation, all told, everybody together. So my journey has been a little bit circuitous. I started with medical school planning to go into OBGYN, but when I got there, I realized that as a resident, I didn't actually enjoy doing surgery, partly because I had back issues. And so this chronic pain issue that was coming up, obstetrics is not good for back pain, in case anybody is wondering, either as the patient or the doctor.
Right,
And
because
then,
even if you have a really great stool that you can stand on to lean over the OR table, there is a lot of stress on the
yeah,
spine. Yes.
yeah, it's a mess. And so then I transitioned to internal medicine residency with a concentration in women's health, which did include gynecology experiences and training. And following that, I got board certified in actually internal medicine, but then I only worked as an office-based gynecologist within a busy OBGYN practice. And so within that practice, I saw, I guess, 30 patients a day, 5 days a week. So 150 patients per week that were all office-based gynecology patients, which are going to be some sort of standard annuals, but a lot of problem visits relating to sexual dysfunction and sexual concerns. So I sort of found myself in a sexual medicine mini practice within a larger practice. And then I did additional training in sexual medicine. Within the sexual medicine training, I realized that there was and discovered this whole field called sex therapy that I had access to. So I did additional training, so hours of classwork and supervision and all of the things. And I became AASECT certified as a sexuality counselor. And these days, I have my own private practice where I am acting as a sexuality counselor only. I use my medical knowledge to help people who have medical challenges and whose medical challenges are interfering with their sex lives and their sexuality and their sexual expression. And in doing that, I've accumulated a lot of different modalities and skill sets. And not recently, but I've also taken an interest and a liking to hypnotherapy because I find it can really, really help the people who want to make the same changes internally, help them make it faster and more simpler.
Okay. One of the things I love in hearing your story is how you knew exactly what you wanted and how you wanted to serve, and it wasn't available in the place that you thought it would be practicing OBGYN. And you've taken this whole circuitous route, and now you can do exactly what you set out to do. There's a lot to unpack there, although I'm going to take the conversation in another direction. I love seeing that kind of a biographical imprint where you have this desire and you just find the way to make it work, and probably couldn't have predicted how it would be. But here you are. And let me just start right off the bat. Sexual Health Consultants is the name of your practice. Do you work with people virtually? If someone's listening and they want to follow up with you, is that going to be an option or do they need to be local?
I do virtual. That developed with COVID. Everybody was asking me to do it before then, but I was so busy with in person that I actually declined to go in that direction. I prefer in-person visits because I can get a sense of everybody's energy level, and I very often work with couples, and couples are very challenging because there's two people in the room, and both of them are experiencing a lot of emotional stuff in those moments that I'm talking, even if I'm not talking to them, right? So it's helpful to be in person, especially with couples. But I have pivoted just like everybody else during our strange world with pandemic. So I do offer virtual appointments these days. Yes.
Okay, wonderful. So I took a quote from your website. It's sexualhealthconsultants.com, right? Is that what it is? Yeah.
Yes.
And it really caught my attention. So let me just share it with everyone. It's where you're answering the question, what is sex therapy? And you say sex therapy focuses on the emotional aspects of the sexual experience and the connection between the emotions and the physicality of sex. And the reason that I picked out this paragraph is I really think most people assume that sex therapy is focused on improving your technique and refining the mechanics. And yet, what you write here, I'm going to read it again, is sex therapy focuses on the emotional aspects of the sexual experience. Would you share, is that a conventional definition? Is that one you've come to yourself? And do people come to you self identifying as having emotional challenges around sex?
I believe I made that up myself. I make most of my own definitions up. I have a whole slew of them. But
I think you did because I think it's so true. It's so profound. It's also so basic, but I've never seen it anywhere else.
yeah, yeah, I think that most people who do come in do identify that they're having distress and that distress is an emotional state. So I think that the people that do come to see me do realize that. I think that the disconnect is that most people who have distress around sex do not realize that that distress does not need to be there.
Okay, so what's a common problem? Let's say a couple comes, let's set it up so it's particularly relevant for my audience. A couple's been married anywhere between 5 and 15 years, and the sex is just awkward, complicated, infrequent. What kind of situation might they seek you out, and then how do you respond?
So I get the first appointment is always going to be me getting a lay of the land. I'm trained as a physician, so I'm going to get their medical history first. And that's very simple. It's sort of like, what medical problems, what medications, those types of things. And then I find out about where they identify. Each of them actually identifies the sexual dysfunction that they perceive is at a different location in their sexual script. So we'll go through the sexual script, which means I'm a fly on the wall and you tell me what exactly your sex experience is like with each other. And when they do that, I stop them along the way. Okay. And so when he did that, how did that feel? Were you ready? And then I'll ask the man, if it's a heterosexual couple, how did you know when to stop touching her breasts and start touching her vulva or vagina? When did you decide that? And he's like, well, I had to look at all the cues. And so what ends up happening is each partner gets a much deeper understanding of the experience, the internal experience that their partner is having. They also have the opportunity, of course, to like introspect and find out what exactly they're feeling by my pointed, direct questions that are connecting the mind and the body in those moments. So we basically slow down their average sexual experience so that I can learn as the therapist what their experience is when X, Y, and Z happens.
Okay, so if someone has the courage, or let's just say if a couple has the courage, and sex is not glorious and nourishing and inspired for both of them. If they have the courage, this is something that a couple could do themselves. In fact, I'm thinking in my marriage, one of the really significant turning points was when I did express what my experience was during a particular moment in sex. I didn't do it during sex, I did it
Right.
afterwards. I don't mean immediately afterwards when we're lying
Yeah,
there.
yeah, yeah.
I mean like a few days later. But there was something that I thought was so obvious because it happened every time that we had sex. And I found the courage to say something about it. And my husband was shocked. He was like, "Really? That's your experience?" And it was such a revelation for me. And I have to say, it provided a lot of positive feedback for me to find the courage and bring things up, because this was something that to me was, it was as obvious as the sky is blue. Like I couldn't imagine that the two of us would have been having these sexual experiences together without him realizing something that was so obvious to me. But in fact, we had had sex hundreds of times, having had this particular experience, and he wasn't aware and didn't interpret it the way I did at all. And so having that come to light has meant that anytime I think something is obvious, I'm like, well, it's still worth saying it because maybe it's not.
Yes, absolutely. So that is exactly the pathway we take. What I find happens with many of my clients is they don't have an awareness of that thing. So they'll have an emotional reaction to it, but they won't necessarily know what it was that caused their emotional reaction. And so then their emotional reaction becomes their baseline. And so all they can respond is, I don't like that, or that's not good, or that makes me mad, or something to that effect, or you didn't do it right, or something like that. And it can become a critical cycle where there's anxiety on both parts, on both partners, because each partner is not aware of their own sort of uh, causal experiences, and then not necessarily relating that to their emotional place. And it's all interactive in the moment, right? The anxiety is dynamic, just like love is. It transfers between people. So if one person has anxiety about something that's going to happen, whether they know, whether like pain, for example, then the other person is feeling anxiety as well. Even if they're not feeling the same anxiety, they're feeling it as well. There's a disconnect there. So, so it's very hard sometimes, and it takes a long time. So it sounds like this thing had been happening for you for a very long time, and it took a while to figure out that it was there at all, and then to actually have the courage to say it, which you did.
Yes, and I know that it's much easier to understand what we're talking about if I'm specific, but because I haven't asked my husband if he's okay with my sharing this, I'm continuing to speak in more generic terms. I share all kinds of things about our marriage, but there are certain elements that I know it's best to say, would you mind if I shared this? So, since I can't offer the specificity because I didn't know to ask him first, will you give a very specific example so it's easier to imagine? Like, what's the kind of thing that happens? You mentioned pain, but can we be even more particular?
So, absolutely. So many times, and I mean, I will speak for today mostly in heteronormative terms, although I see couples of all different genders, orientations, and everything. But very commonly, a man is running the show, in the sense that he might be determining the flow of the activity of when one thing goes to the next thing. And there's a ton of anxiety associated with that for a lot of men. Some may find it completely natural and just like, oh yeah, well now it feels normal and natural for me to move from this activity to the next activity. But others may sort of have to second guess themselves. Is my partner enjoying herself? Is it okay? Is it too early? Is it too not too early? What do I do? And then if he reaches down like to her vulva vagina area and she's not perfectly wet, what is his thought process? Does he experience that as that she's turned off? Does he experience that as somehow he's doing something wrong and it's critical? And this happens in the other direction as well. If a man loses his erection, what does it mean? What does it mean to the woman? What does it mean to him? And both people were raised with different expectations about what erections are supposed to do. Both people are probably raised with not the most accurate expectations of what erections are supposed to do,
Well, what are
but
they supposed to do?
erections are so great. They're supposed to go up, they're supposed to go down. They go up, they go down, they go up and go down. It does not matter. They go up, they go down, doesn't matter. And so when I mean, I'm being flippant, but when I tell this to couples, they're just like, "Oh, you mean if the erection goes down, we don't have to stop sex?" It's like, "No. You can do something that's fun. The penis is not the only fun zone on the body. Like, really, find another place. It doesn't matter. You're not even waiting for the penis to come up. You're just having fun somewhere else."
Yeah, it's so basic, but I think in marital sex, it's actually not uncommon for people to forget that sex is fun.
Mhm.
And just bringing some playfulness back into the whole endeavor rather than being so goal oriented to penetrative sex and everybody has an orgasm or two, that just shifting and allowing it to be playful opens up so many new flavors and brings more aliveness, particularly when we're talking about sex with the same person for many, many, many years.
Absolutely. Absolutely. And talking about it in terms of your inner experience and not just actions, right? Not just the
Will you give
sort
an
of screenplay.
example of what that would be? Like, what's a way that I would say something that's just focused on the action versus saying something that's focused on conveying my emotional internal experience?
Um, a lot of corrective feedbacks are given around actions instead of emotional internal experience. So that would be like if a woman says, "Don't touch me there," or like a breast, "You're squeezing too hard." Okay. And in fact, her full emotional experience was her breasts have been tender for a while. She has some anxiety around that relating to all of the fears that are sort of inbred in that. And then he reaches for her breast and she's uncomfortable and her body tenses up, and then she's not going to feel pleasure no matter what, because she's in a space of emotionally disconnection, this being feeling disconnected from her breasts. This can happen relating to having a poor self-image about your breasts, if they're too big, too small, too whatever. It can happen as a result of illness or cancer. There can be a ton of things that are going on inside the woman around her feelings about her own body, but the only thing that she may express is, "Don't do that, that hurts, it's too hard, it's too much, just don't touch me there." And so there's a sense that there's stuff under the surface like an iceberg, but there's not a clarity about what's under the surface, and there's not an actual openness around it. And I don't think that's intentional. I think that's just how we are trained to talk around the actions and the behaviors, not necessarily around the motivations and the internal experiences.
Okay, this is so interesting to me because I would imagine that if I'm sharing something emotional, like what you're talking about, my husband would be interested, he would be present, it would be a very positive interaction, and he'd be stuck not knowing what to do the next time because in hearing about my emotional state, like in the example you're describing, he might conclude, I better just stay away from the breasts because they're dangerous. So I understand that saying don't don't do that is not going to be helpful. It is helpful to say, my breasts are tender and I'm concerned about this and I feel stress. And once somebody in sixth grade made fun of me there, and all of this is coming to the fore, and this is my rich internal world, and it's uncomfortable. And I want you to know that this is what's dominating my experience right now. Not that it would be said that way. That's like my translation. And then where do we go from there so that I can be receptive and I'll be open to a new experience, and my sexual partner can have the courage to find a way to touch me that's going to work in this emotional soup rather than just have one and then both of us shut down?
That's a really good question. And that's exactly what does happen in real life is when we open up, then our partners take all of that as a burden about things that they can and cannot and should not do. And then we just add anxiety to their inner world. Unless they don't actually have to find a new way to touch us, unless we can actually tell them ourselves, which is where the self-exploration and self-discovery comes from. And so the most constructive answer that the male partner can give in the example that I gave would be, thank you for sharing, very warm and supportive and all those things. And then how can I touch your breasts that makes you feel pleasure and makes you feel good? And this is a question that many women have not necessarily always considered, because they expected the man to try and then they have to say yes or no. And so they get to be this game of bring me a rock, right? How let's see if you can touch me right this time. Let's see if you can touch me right this time. And it's not intentional. There is no expectation that this is a test from the woman's perspective, but the man knows it is. And so many times there's this unwritten pattern that is not intentional, but it's really present. So my answer to that is, it's your responsibility to teach your partner how to touch you. It's their responsibility to learn, but it's your responsibility to teach.
And it's everyone's responsibility to have a discussion about it, because the
Right.
fact is that for the vast majority of couples, it is much simpler to have sex than to have a conversation about it. So I love the landscape that you've painted, which really includes our every one of us taking responsibility to find out what brings us pleasure and then convey that, and of course to have the conversation. And so if you're listening and this is not a typical topic of conversation that you have with your partner, I recommend that you just start by saying, I love you, I love our life together, we've had some amazing experiences, and I think that we could have even better experiences in the bedroom. It can be that tame. Like I usually encourage, particularly a woman who wants to bring up something that she wants different or she's dissatisfied, to start by saying, this relationship is good and I want to make this arena better. And even if you don't have anything specific to say about what to do differently, just to bring it into the realm of conversation is the first step, which I suppose has already happened by the time somebody is seeing you in the office. They've had a conversation before getting there. But I really encourage people not even to try to accomplish anything other than to say, let's start talking about this. That's enough for the first conversation.
Absolutely. The conversations are really, really hard because we're not taught how to advocate for our sexual pleasure, especially women. And we're not really taught how to have full and complete sexual agency. And we're not taught what that looks like when our partner does. And so when our partner says something, many times it's a matter of, okay, now I've got to do that, or, oh, I guess I've got to change, or I guess I wasn't doing it right. And we interpret a lot about what it all means. So there's layers and layers of conversation and communication around the what's happening, around the what I'm feeling, and around the what I think it means. And when you really get down to the what I think it means, that's where your core beliefs are held. And that can be really difficult to, if you just have different beliefs around something. And those different beliefs lead to different emotions, and those different emotions lead to different behaviors. And that's where the sex therapy comes in, is around what the beliefs are.
Okay. Will you share how you live this personally? Like you've been married for how long?
Almost 10 years.
Okay. So we how does this work, being a professional and then having your own two bodies, messy sex life? How does that work? How do you bring it home what you know and are so brilliant at doing professionally?
Well, I think that in the course of my marriage, I learned something about men, right? Because I'm not a man, and so I had a lot to learn. And I learned that um, they have a lot of anxiety around sex that is not something that you could always put your finger on. And so I think that I didn't consider myself critical, um, and at the beginning of our relationship, but I think that I have been interpreted that way. As I tried to initiate and manage conversation, I think that it was easy to be interpreted as critical because I was not fully aware of his internal world. And
Yes.
so I learned that, and over time, it makes conversation a lot easier since he knows I'm not intending to be critical, and I can also verbally say that if there's any sort of something, and he knows that it's okay if I'm disappointed for any reason, because his job is not to make me happy at every single moment. His job is to be him. And so that's been powerful, because we have that understanding now. There are much fewer miscommunications, misunderstandings, and the communication is simpler. It's sort of like, oh, I can tell him when I'm disappointed without worrying that he's going to, like, I'm disappointed that, he's not home and we can't have sex tonight. It's not his fault. Or even if there's something more specific that was relating to him or something, that's not his fault. I'm just going to say I'm disappointed, because if I don't say it, he won't know it. And if he doesn't know it, then we don't actually have that bit of communication between us. So that's been something that I've grown into, and I think he has too, and that's been very helpful. But it's not where we started.
I love that so much. I'm grinning broadly over here because I think that is really the highest level of emotional intelligence and also the context for the most amazing, passionate times together when each person is responsible for their own experience. And I think that probably a lot of women who are in relationships with men think, if I'm disappointed, he doesn't really care. But that is not true. It is devastating. And most of the time, a man just doesn't know what to do with her disappointment. And so he withdraws, and it can be interpreted as rejection or lack of caring. But really, it's pretty devastating. And so I think of that as a high evolutionary state that your husband has achieved, that he can be in the presence of your disappointment. He can love you. He can be in connection with you without taking it on as his own failing. That's totally amazing. And for anyone who listens to this podcast, you know that I always ask my guests, because relationships are the vehicle for personal growth, what is it that you've learned about yourself as a result of being in the relationship, in the marriage you're in? And maybe you've already answered that, but is there anything that you want to add?
Um, I think that going through my own long-term relationship has definitely made me a better counselor and sex therapist. I went into women's health originally. I was like drawn to women. I was like, oh, I like working with women. I want to fix women's problems. Actually, I really appreciate what men are going through in having sex with complex women. And women are complex, but they're not like they're not ununderstandable. I mean, there's this meme that perhaps many of you have seen that, has men's desire sort of button for sex is a single light switch. And then the women is to turn them on. It's like, all of these complex dials and buttons. And it's a funny meme, but it's not true. And people are laughing because they think it's, like it's cute, but it's also simplifies men. And so the simplification of men within the sex and their relationship with sex, their relationship with their own sexuality, and their relationship with their partner is something that I aim to sort of elucidate, that it's not that simple. Men are not that simple, and they have a lot of things going on. So I've learned that I didn't know as much about men as I thought I did in my marriage and in my experiences. And I appreciate the learning that I've had on that level, because I think it really has translated really, really well to understanding couples and individuals better, regardless of their gender.
Yeah, that is incredible. I think it's so important to start with curiosity, but sometimes it takes an experience that just hits us over the head, which lets us realize how many assumptions we've been making. It's sort of nice to gently start with curiosity, but sometimes we have that kind of an epiphany through an unpleasant experience. But maybe I'll ask you, I think there are a lot of people who are heteronormative with an open heart and a desire to be inclusive, but don't really know the way around respectfully speaking about gender fluidity and how to even, I mean, we can learn how to use the different pronouns, but it's clear when you speak that you really have an ease navigating any kind of gender identity situation. And I wonder if you have a few words of encouragement and instruction for someone listening who'd like to have that kind of warmth and clarity without necessarily having the life experiences to bring it to them.
Sure. So when you think about the diversity within genders, the simplest way that I have to conceptualize it is that if you're not identified clearly as male or self-identified clearly as male or female, then you are a minority, a sexual minority. And so I look at sexual and the dynamic, gender community, the continuum there, as simply minorities. And so with a minority, a group, I would just be curious and say, what is it that's important to you? How can I honor you and not ignore you? How do I make you not invisible without necessarily sort of being extra, extra, extra on everything? Right. And so that's why I usually start with an apology. Like, hey, I'm going to talk about in a heteronormative way right now. That does not mean I don't care about you. It doesn't mean that I'm trying to exclude you. I actually do care. I'm just going to name what I'm doing right now. And my naming it actually gives them visibility, feels validating, because I can still speak that way without necessarily offending people. It's really when you speak in a way that ignores people that they get offended. So I think that's the rule I live by. Now, I'm not necessarily in a minority status, so I don't know how that lands for people, and I acknowledge that what I just said might not be right for some people, but that's how I manage it, because I welcome to everybody come in my door, personally or professionally, and whoever you are, it doesn't really matter to me, but I don't want to ignore you or exclude you.
Okay, I think that is such a beautiful way of framing it, and anyone in any context can relate. And I think that one of the kind of essential experiences at one point or another where it feels like we're not understood, we're not seen, we're not responded to, it's not obvious what our experience is, and yet that is more true for some than for others, of course. Okay,
Mhm.
that's so great. So if someone wants to follow up and be in your world or consult you, I've mentioned sexualhealthconsultants.com. And what else would you like people to know about what's available through you?
Yes, you can reach me through sexualhealthconsultants.com. And I have a form there, like a contact me form that you can fill out. It also has more information about the type of work that I do and the types of health conditions that I, have experience with and focus on. I also have a mini course in getting your sexy back after breast cancer that is available, and that is available through the website as well. It's a 6-week course that really helps women with breast cancer sort of reclaim their sexual identity after their medical trauma. And that's pretty much it. Oh, and I do presentations in the hypnosis community, sort of advocating and expressing sexual dysfunction and how hypnosis can help with that. I am certified as a sexual freedom hypnosis provider. So it's not erotic hypnosis. It's actually sexual freedom hypnosis, which is a lot more focused on releasing shame, releasing anxiety, and sort of identifying your true sexual power.
Yeah, I love that you distinguish it from erotic hypnosis, which is not really a therapeutic modality. I suppose it could be used that way, but it helps bring more turn on in an indirect manner. I'll just simply say, as opposed to using it for healing. But I want to go back to something you just said. So this just sounds incredible. My grandmother had breast cancer, my mother had breast cancer. I'm really aware of the importance of bringing back the sexy after breast cancer. But if someone hears that you offer this program, listening to this podcast, and thinks, oh, my neighbor just completed her treatment, or my mother in law just got diagnosed. In other words, if someone is listening and the program is for themselves, well, they can go register and enroll. That's very straightforward. But do you have any guidance in how to tell someone about your program? Like if I know someone that I think is really going to benefit from your program, but we haven't talked about sex, and I'm not someone who really tells this person anything about erotic identity, what's a way to bring this conversation up so that someone can benefit from this incredible program you have?
I think that, you know, you hit upon something that's very interesting, is that people, both lay people, so friends, family members, coworkers of breast cancer patients, as well as the physicians and medical providers of breast cancer patients, are very reticent to mention the sex thing. It's uncomfortable.
Even though it is like
Massive.
front and
Yeah.
center in a woman's experience when navigating breast cancer.
Yeah. And so I think that probably the best way to bring it up, if you have a friend or family member with breast cancer that you would like to share my program with, would be to be as direct as possible, knowing that the information is only going to land on the person who needs it when the time is right for that person. So you don't actually need to probe, how are things going with sex? Have you started sex again? Are you interested in doing a program? You could actually say, I know that you're going through a lot with breast cancer. I saw this thing, thought maybe it would be interesting to you today or some other day. And so here's the information of the website. And, if you want it, you can have it. But I just want to let you know it's available. And then sort of float it and then let it be. You don't have to probe, because a woman who is ready to get her sexy back will find me. A woman who is not ready does not need the program yet.
Okay, I love that. That is so respectful and relevant in sharing about your program. And honestly, I think that's true for all aspects of sexuality, that when the desire arises, you're here, I'm here, so much is available. And when the desire isn't there, well, then it's just not time.
Right.
So
Exactly.
let's end right there. I'm so grateful that you've taken the time to share what you've shared. And I hope people follow up, because I think you are a gem.
Oh, thank you so much, Alexandra. I've had a good time. Thank you for inviting me. I'm honored to be here, and I'm thrilled that we got this chat.
Thank you for joining me for this episode of the Marriage Podcast. Please rate and review the show on iTunes. It really makes a difference. And if you have a question or a comment, reach out to me via my website at alexandrastockwell.com.